I'm Dr. Matthew Schulman, board certified plastic surgeon, and let's go over 5 signs that you might be a great candidate for a tummy tuck. Let's start by reviewing what a tummy tuck is. A tummy tuck, or the fancy word abdominoplasty, is one of the most common plastic surgery procedures designed to rejuvenate your abdomen. So the procedure is going to remove extra skin, tighten muscle, narrow the waist, and just make your entire abdominal muscles look better. So here we go. Sign number 1 that you might be a great candidate for a tummy tuck. You have extra skin of your abdomen. So if you have loose hanging skin that's either the result of pregnancies or aging or weight loss, you might be a great candidate for a tummy tuck because a tummy tuck is going to remove that extra skin. Sign number 2, you have separation of your abdominal muscles. So if your abdominal muscles, which is your 6-pack muscles, are separated, you are going to be a great candidate for a tummy tuck because one of the key parts of a tummy tuck or abdominoplasty is to sew those muscles together and tighten those muscles. Separation of the muscles is called a diastasis. So you might have been told by your doctor that you have a rectus diastasis, which means separation of your rectus or abdominal muscles. This commonly results from pregnancies. When the baby inside is growing, things stretch and it makes those abdominal muscles separate. When you're doing a sit-up and you lift your head up, you can actually feel that your muscles are separated. So they're not in the middle like this, they're actually apart, and you'll feel something bulging in between. Sometimes you can even see it. That's a rectus diastasis, and that's a separation of the muscles which is repaired during your tummy tuck. Third sign that you are a good candidate for a tummy tuck is poor quality of skin of your abdomen. So if you have skin on your belly that has a lot of stretch marks, that signifies that you have lost collagen or you have breakdown in the supporting structures of your abdominal skin. So skin that's been stretched out from aging or pregnancies or weight loss is going to have stretch marks and most likely is going to be loose. So if you have extra skin of your belly and lots of stretch marks, that might be a sign that you could be a good candidate for a tummy tuck. Sign number 4 that you might be a good candidate for a tummy tuck is you just can't get rid of the extra fat and extra skin and just make your belly look better through diet and exercise. So if you're someone who's active and you exercise regularly, you eat appropriately, but you just feel like your stomach is just always round, or you always feel like you're pregnant, or you just have extra stuff or that spare tire that you just can't get rid of, you probably are a good candidate for a tummy tuck. This is because that area is often difficult to target with just diet and exercise, and sometimes you actually need a surgeon to remove the skin, remove the fat, and fix the muscles in that area. So if you find that despite diet and exercise, you just can't get improvement in your waistline, you may want to consider a tummy tuck. And the 5th sign that you might be a good candidate for a tummy tuck is just that you're uncomfortable with the way your belly looks. It's as simple as that. If you look at yourself and you just feel like you don't like the way your belly looks, you feel like it's not as flat as you want it, your waist isn't as small as you want it, then you may be a good candidate for a tummy tuck. So all these other things we talk about, extra skin and separation of muscles, doesn't really matter if you're comfortable with the way you look. But if you are uncomfortable and you want to do something about it, then a tummy tuck may be just what you need in order to give you the appearance that makes you feel better about yourself. So I'm Dr. Schulman, and these were 5 signs that you might be a good candidate for a tummy tuck. Hopefully that answered some of your questions. If you enjoyed this video, make sure to like, comment, and share, and check out the other videos on my YouTube channel.